And here to talk more about this is Bridget Brennan. She's Special Narcotics Prosecutor for New York City. Bridget, thank you very much for a few minutes. I appreciate it.
I'm glad to be here.
You know, we've gone through the numbers, and as we've shown here, whether it's from the city or the suburbs or even into some of the upstate communities, it's amazing the explosion that we've seen in heroin use in the last 4 or 5 years. I know you're not new to this. We've talked before, you and I, in fact, about meth labs and their explosion, and we've seen, obviously, prescription drugs. But can you compare this to anything we've seen, this level of explosion that we've seen with heroin?
Now, I think this is unique. Crack exploded on the scene, but crack was really kind of localized, and it was distributed by local groups. What we're seeing with heroin is really very unusual, very unique. And
why has the reputation of heroin changed? I mean, I'm in my mid-40s, and I remember, in the 70s and 80s, the idea is the idea was a street junkie were the only users of heroin. Now, I think its reputation's been sanitized in some way, but the significance and severity of the drug hasn't.
Yeah, I think you hit the nail on the head when you pointed out that to people in their 40s or in their 50s, they have a recollection of the devastation of heroin way back in the 1960s and 70s and all the problems that it caused and the terrible toll that it took on many neighborhoods, but primarily impoverished neighborhoods. It was really viewed as a drug of last resort, drug for the most desperate and downtrodden. And I think since it's been such a long time, people have lost their memory of it. And the second thing to keep in mind is that the heroin that we are seeing now is actually much different than the heroin that we saw in the 70s. It's much more pure. Back in the 70s, that heroin primarily came from Asia. It traveled a long distance, and it was mixed with a lot of what we call cut, a lot of other things that were diluting it. So it wasn't as powerful as the heroin that's being distributed today. And because the heroin is so powerful today, it can be snorted, and the users can get a high off of snorting it. So the initial use isn't necessarily intravenous drug use. And that, too, makes heroin a more attractive option to somebody who might be interested in just experimenting with drugs.
And because, Bridget, the transport of the drug doesn't have to come from several continents away, I understand that's driven down the price of this, which has made it more accessible to more people, and that's part of the big problem you're dealing with, right?
Absolutely. What we started to see in the mid-90s was the Colombians started to home produce heroin. They brought in chemists who knew how to produce a product that they thought would sell well, particularly in the United States. And then we started to seize loads of heroin mixed in with loads of cocaine. And gradually, we started to see more and more heroin coming into this country. I think the big change that we've seen in the last 5 years is these heavy volume mills that are producing literally millions of glassines of heroin. Hundreds of thousands of glassines of heroin are being milled out, are being put together. It's user-ready envelopes of heroin ready to hit the streets. And the production is much closer to the source. That's another big difference from what we saw with heroin in the last time around. The last heroin epidemic was very much different.
You know, I know the answer to this question before I ask is probably both, but if you had to prioritize on, I know you have several strategies that you've used effectively, including some major busts recently on trying to stop the scourge of this, but are you attacking this more from the supply side, Bridget, or are you trying to curb it on the demand side?
Well, because we're law enforcement, of course, our first priority is attacking it on the supply side. And what I've seen through the years is the larger the supply of drug out there, the greater the demand is going to be. Those selling the drug, if they have a lot of it, they'll produce their own demand. But it's not, of course, the only priority. Reducing demand is a huge priority, and that's the ultimate solution. And I think what we are, given the new user group, the fact that the new users, the new people initiating heroin use, tend to be younger and better educated, I think that group may be more receptive to education, to public awareness campaigns, to the kind of campaigns that have really discouraged tobacco smoking and that sort of thing. So I think we can make great strides if we employ both prongs of the attack, if we look at prevention as well as looking at reducing the supply.
You know, there's this argument out there that, hey, we're talking about the same amount of users. They're just, because of the crackdown on prescription drugs, now they're going to heroin instead. Is that myth or reality?
From what I can see, it's a myth. We looked at the statistics on the number of prescriptions for the opioid drugs, and we've seen that they continued to increase. At the same time, heroin overdose were increasing, heroin deaths were increasing. So we saw both going up at the same time. So what we have to remember is the two are operating independently. Our nation, and particularly our young, our middle class, our blue collar workers, are developing more of an appetite for opiates, whether it comes in pill form or whether it comes in white powder in a little glassine bag. We're developing a greater appetite for opiates, and one is not to the exclusion of the other.
You know, I've heard some people say we're also, while we're cracking down on it, maybe we ought to treat this differently and talk about drug courts, if you will, and give an idea who they should be intended for. I mean, for example, one of the people associated with the Philip Seymour Hoffman case, who was seen as the dealer in this, he says he'd like to go to drug court. When does drug court most efficiently be used, and for whom?
Well, we've been using drug courts, some variation of alternative to incarceration, for about 25 years, 30 years in my office. So we're very familiar with it. But what we've seen actually with the changes in the statute is that drug courts or diversion using drug treatment as an alternative to incarceration has become less and less attractive. We've seen fewer and fewer of our defendants interested in going into treatment because they aren't really facing any substantial period of incarceration. And so unfortunately, what we've seen in the last 3 or 4 years is a big decline in the number of people going into our drug treatment programs. Who should they be for? They should obviously be for the addicts, for the person who is selling drugs to support their own addiction. I mean, that should be the target group. And they should be for those who have no history of violence and who don't present a danger to society because they're going into treatment programs, which are in the community, in residential neighborhoods. They don't have bars on them. And so we have to make sure that it's a safe situation for everybody.
You know, anecdotally, Bridget, and you're much closer to me, but this weekend I happened to have a conversation with a principal from a suburban school, and I mentioned, you know, I've been talking to people both involved in law enforcement and families who either lost siblings or children to heroin abuse, and I was surprised at some of the numbers. And she just shook her head and said, you have no idea what it's been like the last few years. And she said her colleagues all across the state are running into the same thing. You're not dealing with this on an anecdotal level, you're doing this on a real level. Would the public be surprised just how fast and how wide this has spread in recent years, and who are some of these abusers we're talking about?
I think many people would be surprised, but not that group that you're talking about. I mean, the principals know it, people who are in drug treatment know it. It's because the people who are developing these addictions now, the new user groups, are better educated, have more money. There's a bigger security blanket around them. There's a bigger safety net around them. And so we're not seeing what we saw in the 70s or the 80s. We're not seeing people nodding out on the streets. We're not seeing that same devastation isn't as obvious to us, but it is just as present. And it's a great tragedy. I mean, we talked to parents who expected to be taken care of in their older years, who are taking care of their children who are addicted either to pills or heroin, who are spending their times nodding out in the basement. You know, it's a great tragedy in many, many families.
And just to that point, so many say it's not just the addict that's the victim of this, it's so many times the entire family. Bridget, I really appreciate a few minutes. That's Bridget Brennan, again, Special Narcotics
Sure.
Prosecutor for New York City.
Thank you.